We've talked about why some parts of the body will exhibit a different temperature to others. The skin is subject to a large number of environmental factors, whether there's a draft, whether there's an air conditioning unit, whether there's a radiator, what the ambient room temperature is. So some readings are more reliable than others. The one that I favour most, and the one that doctors in hospital use all the time these days, is the ear thermometer. And this works by shining a light through a probe in the outer ear canal against the eardrum. And it gives us a very accurate reading of core body temperature. It's very quick to do, it takes less than a second, and it's reproducible. It's easy, as I say, to do, and it can be done on a regular basis so we can see how the temperature is progressing. If, however, a child is fractious because they've got an ear infection, say, and they don't want anything put near their ear, the 3-in-1 thermometer by Brother Max has the advantage of being able to use the probe as a scan across the whole of the forehead, which will detect the hottest part of the forehead and then avoid the possibility that you're missing the accurate temperature. So ear temperature first, forehead temperature second, but something that does it all in one, 3-in-1 as it were, the ambient room temperature, the eardrum temperature and the forehead temperature is an ideal thermometer to have at home. Well, if you think about the factors which can influence, say, a forehead temperature reading, we know that the skin can be cooled by perspiration. So if somebody is sweating, the temperature will be cooler. It can be greater on one side of the forehead compared to another side if someone is sitting next to, say, a radiator or an air conditioning unit. If they're wearing cosmetics or even moisturising oils, it can affect the reading. So I think it's important to be able to interpret a forehead reading on the basis of those possibilities. Many things can affect it. If they've been lying on their pillow on their front for a little while, it's going to affect the reading. If you're taking it from a part of the forehead where there are more prominent veins, the result's going to be higher than if you take it from the forehead over prominent bone. So it is important to understand that. And when it comes to the ear, which is the type of temperature checking area that doctors favour in hospitals, a lot will depend on the technique used. It's pretty easy to use the ear probe, but if you're not angulating it in the right way and hitting the eardrum with the light through the probe, then you're going to be hitting the ear canal skin itself, which is not quite as accurate as when you hit the eardrum itself. Movement of the hand of the person using the thermometer can affect the result. So can the possibility that the patient has been lying on that side as opposed to the other side. If they've recently been swimming or bathing and there's been water in the ear. The presence of earwax obstructing the light shining on the eardrum. And for these kind of reasons, it's not surprising that you might get a different result in the right ear compared to the left ear. It wouldn't be a huge difference, but there'll be some difference, and that's the explanation. So correct technique's important, and understanding of the different factors that influence temperature is important. And whether you're checking forehead results or ear results, the temperature of the room that the person's in will have a bearing on it as well, because a room that's 24 degrees centigrade compared to a room that's 16 is going to affect the body temperature to a certain extent.